suffer from sleep apnea, Middlesex Hospital has some treatments that might just help.
That's right. And joining us right now is Dr. Mark D'Agostino, the Chief of Otolaryngology at Middlesex Hospital.
Hi there.
It's great to have you with us.
Thank you. Thanks for having me.
No doubt about it. Thank you so much for joining us. Sleep apnea, is it something that more people have than they think?
Absolutely. Absolutely. It's estimated that approximately 25 million people in the U.S. have it, and a very small percentage are treated.
It is something that people don't understand, that it can be easily treated.
Correct. Absolutely. There's a lot of different treatment options for sleep apnea, and the standard treatment is what's called CPAP. So it's a mask that the patient wears at night that keeps the airway open. I mean, what sleep apnea is the airway occludes when the patient sleeps. So what the CPAP does is it keeps the airway open, but approximately 50% of people can't wear the CPAP, and that's where we look at some of the other treatment options.
And before we get to that, what are some of the symptoms? So if maybe your husband and wife or wife at night, they're laying next to you, are they snoring, or what's the deal?
So what the bed partner notices is snoring. Sometimes they may notice restless sleeping, moving the legs around a lot. They may hear some gasping or choking, but they may not. What the patient notices is they get up in the morning and they're tired. And they're tired all day long. They have a headache. They may have some memory or concentration problems. They may have to get up and go to the bathroom a lot. These are all kind of some of the signs or symptoms that somebody may have some apnea.
And Dr. D'Agostino, for the most part, though, the person who is having these issues don't want to go in for treatment, generally needs the other person to give them a nudge.
Right. It's usually the spouse dragging them in, or the fact they want to get back in bed with the spouse because they're sleeping in another room.
Yes.
That drags them in.
It's a tough situation.
What are some of the solutions now, though, because technology has advanced so much?
Right. So again, the standard treatment is the CPAP, and that's what we start everybody on. It's the least invasive and easiest way to treat it. If somebody can wear the CPAP, then their apnea really should be controlled. But unfortunately, 50% of people can't wear it. So we look at some other options. There are mouthpieces that we'll make for the patient to hold the jaw forward. It kind of keeps the airway open. If they can't do that, sometimes there's some surgical options that we do to try to open up the airway. We'll try to fix where we think the problem is, the palate, the tonsils, the base of tongue. But we now have a newer therapy that we're doing.
You brought it with you.
Yeah, so this is called neural stimulation, or upper airway stimulation therapy.
You want to show us how that works?
Sure. So it's actually a totally different concept from, in standard surgery, we're trying to alter the anatomy. We're trying to open up the airway. And typically the patients are pretty sore afterwards. It's an overnight stay in the hospital. It's about a 2-week recovery. This therapy is actually, it's neural stimulation. So what we're doing with this is we're stimulating the nerve to the tongue to pull the tongue forward. So when we put this in, basically we're not going inside the mouth, we're not altering the anatomy of the patient. This goes under the skin. It's just like a pacemaker that you would wear for your heart. And there's 2 wires that go along with it. One goes between the rib and one goes to the nerve to the tongue. So it's all done externally under the skin. We're not going in the mouth. Patients go home the same day, and the recovery is a lot easier. Once it gets activated, what happens is the patient comes back to the office post-operatively, we activate it, and we give them this remote control. And what the remote control does is when they go to bed at night, they will hold the remote control over the unit and turn it on. And there's a lag time where nothing happens, so the patient can fall asleep.
How effective is this?
So, and once they're asleep, every time they take a breath in, it pulls the tongue forward, opens up the airway. This is very effective. It's probably the most effective surgical treatment that we have so far with sleep apnea. The trial that was published for the FDA showed about an 80% reduction in the apnea index and oxygen desaturation index. It was an 85% bed partner satisfaction in the snoring. We just published our data from Middlesex, and we presented it at a meeting, and our success rate was about 80% too. So it's of all the surgical procedures, it's probably the highest we have right now.
I need to come see you at the hospital, do a story on this.
Yeah, absolutely.
And maybe for the hubby at home, if he's not sleeping well.
Oh, yes.
We're talking about you. You guys can head on over to middlesexhospital.org for more information.
It is a serious
we want to thank you so much.
Thanks for having me.
joining us.
Thank you.
All right, more CT Style when we return. We'll be right back.